Hello my dear doctors, welcome back. Now we are moving towards totally a new segment in upper limb topic. After discussing about all the major nerves, now let's get started with the pectoral region here, this region. And in this region, the planning here is, first of all, I'll tell you about all the muscles here guys. So first we'll be seeing all the muscles in the front view, like layer by layer. And after that, we'll be seeing the muscles in the back view. I'll be turning like this and we'll be seeing the muscles behind. Now, once you will be familiar with all the muscles here in this region, then we'll see their nerve supply. And after that, we'll see all the topics related with this region, guys. For example, we are going to learn about the deltoid muscle, abduction of the arm, the nerves related to humerus, rotator cuff, axilla, the boundaries and contents of axilla. So, every topic related with this region will complete in this segment, guys. Okay, so without any further delay, let's first of all get started about all the muscles in this region. First in the front view. So in the front view, we'll see it like layer by layer. Fine. Now the diagram which you are able to see on the screen here, in this diagram, like every student will be easily able to identify this muscle here, guys. That's your deltoid muscle. That's the deltoid muscle, guys. And then this big muscle over here, this one will be actually the pectoralis muscle. And you can easily identify that it is pectoralis major muscle, guys. Pectoralis major muscle. So try to just look at the images carefully there and try to get the orientation properly, guys. Why? Because later on this will help you a lot in other topics also. So this one will be the pectoralis major. And pectoralis major, one important point to remember here, it's actually a huge big muscle there. And recently in one of the exams they have asked, like, it is belonging to like which category of muscle? Is it like a cruciate one or like, So remember the answer for that one is pectoralis major muscle is one of the examples of spiral muscle, guys. Why? Because the origin is very broad, but here at this region here, near the axilla region here, it's going to take a turn and get inserted, guys. So it is one of the examples of your spiral muscles. Now, between the deltoid muscle and the pectoralis major muscle, one more thing to appreciate here is there is a groove here, guys. You're able to appreciate a groove here, and this groove is said to be the deltopectoral groove. This is deltopectoral groove. The name is like very much easier, guys. So between the deltoid muscle and the pectoralis major muscle, you'll be actually having a groove there, that is deltopectoral groove. Now, what do you have inside that deltopectoral groove? That is important. And you can clearly see in the diagram there, you'll be having a vein, and that vein is actually your cephalic vein, guys. So in the deltopectoral groove, you're able to appreciate their cephalic vein. And not only the cephalic vein, along with that, you also have thoracoacromial artery. Thoracoacromial trunk or artery. So it will be actually divided into like 4 branches. We'll go into the detail of that later on, guys. So one of the branch of the thoracoacromial artery will be present over there. We'll go into that in detail later on. So for now, you remember that deltopectoral groove will consist of cephalic vein and a branch of thoracoacromial artery there. Perfect. So this is what you have to be able to identify if this image is given in your exams later on. Now after this, now what we are going to do is, I am going to cut this pectoralis major muscle and just reflect this one, sir. I am going to remove this one. Now once you remove this pectoralis major muscle from here, this is how it looks like. So you'll be able to find one fascia. And look at this fascia, it's actually beginning from here. This is your collarbone or clavicle or your collarbone, and from there you'll be actually having a fascia, and that fascia is actually going down. Okay, and that fascia will be actually going down into your axilla region and all, and that is actually the clavipectoral fascia. So this fascia that you're able to appreciate here, this will be the clavipectoral fascia, guys. Now, if you're able to appreciate one thing there, it will be like more good for you. If you're able to observe the diagram more closely, see there, that fascia is actually enclosing one muscle over here. This muscle. And again, guys, this muscle is also present in which region only? Pectoral region. And this one will be the pectoralis minor. And not only the pectoralis minor muscle, below the clavicle, there will be a small muscle present over here, and that will be the subclavius muscle. So what I am trying to actually put in your mind is that the clavipectoral fascia will be actually splitting and enclosing 2 muscles. One will be the subclavius muscle below the clavicle. Another one will be the pectoralis minor muscle. If you are still not able to understand, let's do one thing. Let's remove this fascia. Now once you remove this fascia, the clavipectoral fascia, the diagram will be something like this. Wow. So in this diagram now you can clearly see here, this is the rib number 3 and the rib number 4 and the rib number 5. So from the rib number 3, 4 and 5 originates a muscle, and this muscle, all these 3 muscle bellies will combine together and they'll be finally inserted onto the coracoid process here. So originating from rib number 3, 4 and 5, then inserting onto the coracoid process here, guys. And this muscle is pectoralis minor muscle. So this one here will be pectoralis minor muscle. And as I said you, just below the clavicle you will be able to find one small muscle here, that is between the clavicle and the first rib there. You can appreciate there. So it is between the clavicle and the first rib there, and this muscle will be the subclavius muscle. Subclavius muscle, guys. So right now your main focus has to be like the name of the muscle, and if the image is given to you, you should be able to identify that muscle, guys. Is it okay? So let us do one thing here. Let us now remove these muscles also, guys. The pectoralis minor muscle, the subclavius muscle, and even whatever that vein, artery, nerves, everything I'm going to remove from there. If you remove all the structures from here, this is how the diagram looks like now. Wow, beautiful. Now in this diagram, my dear friends, yes, you can clearly appreciate here, there is one big muscle, huge muscle, that is like the broadest muscle in our body, coming from the trunk region and then taking a turn, getting inserted onto the humerus bone there. And that muscle, every student is perfect with that. That is latissimus dorsi. That is latissimus dorsi muscle. Our climb burst muscle, guys, latissimus dorsi muscle. Then appreciate one more muscle in this diagram here. There is a muscle which will be actually attached to your upper 8 ribs, the first to 8th rib, guys. So basically it will be attached to your thoracic wall. Okay, it will be attached to that rib cage, upper 8 ribs, guys. And that will be the serratus anterior muscle. Serratus anterior muscle, guys, our boxer's muscle. Okay, the one which will be helping in punching and pushing movements, that is serratus anterior muscle, guys, boxer's muscle. So these two muscles are easily identifiable in this diagram. But the most important thing here is, what about this muscle here, guys? I'm just putting a star mark. Can you identify the star marked muscle? Come on, come on, come on, come on. Now to identify that muscle, let me do one thing here. Let me just remove that rib cage from there, guys. Even the thoracic wall we are going to remove from there. Once I remove this thoracic wall from here, this is how the diagram looks like. And without any doubt, this one will be your latissimus dorsi muscle, sir. I'm just writing in short as lats. And here, this is the star marked muscle. And you can clearly see that it is actually attached to the anterior surface of the scapula. Scapula, your shoulder blade, it's a flat bone, and on the anterior surface there is a big huge muscle that is attached here, and this muscle will be subscapularis muscle, guys. So the muscle which will be attached onto the anterior surface of the scapula will be subscapularis muscle. Is it okay? So if you people have answered as subscapularis muscle, absolutely correct, guys. Is it okay? So that is how, as I told you, our planning here, we are just saying the front view like layer by layer. It should be like a proper animation in your mind. It's like layer by layer, removing like one muscle, one layer, one by one, guys. And just to summarize, let us just do it like once more here, guys, starting from the beginning here. In this diagram here, no doubt about that, the deltoid muscle and the pectoralis major muscle. If you remove this pectoralis major muscle, below this you will be able to find a fascia. That fascia will be the clavipectoral fascia. If you remove this fascia, actually that is the one which is enclosing those two muscles, subclavius muscle and the pectoralis minor muscle. And if I remove these also now, along with all that artery, vein and everything, this is how it looks like. And in this diagram, you will be able to appreciate latissimus dorsi, serratus anterior, and the main important one, in front of the scapula, that is subscapularis muscle. In front of the scapula, subscapularis muscle. Now, once you are done with this one, as I told you, front view completed layer by layer. And now let me take a turn. And while turning, you should be able to appreciate one beautiful muscle here attached to the first 8 ribs, that is serratus anterior muscle, guys. So this muscle which is actually cut here will be the pectoralis major muscle. And this muscle originating from the rib number 3, 4 and 5, that will be the pectoralis minor muscle beneath that. And then I'm actually speaking about this muscle which is originating from the first 8 ribs, you can see there, that will be the serratus anterior muscle. Serratus anterior muscle. and that is actually originating from the first 8 ribs over here, then taking a turn going back, and it will be inserting onto the medial border of the scapula. So scapula will be a flat bone that will go and get inserted onto the medial border of the scapula. So therefore, it will not allow the scapula to leave back. So it is keeping the scapula attached onto the thoracic cage or thoracic wall, guys. So it will be keeping the scapula onto the thoracic wall. Now after that, let me turn completely back here, sir. So once we turn completely back, this is how it looks like. This is the back view. Now in the back view, again the same thing, scapula, flat bone having anterior surface and the posterior surface, and on the posterior surface there will be a spine. On the posterior surface you can clearly see that there will be the spine of scapula. So this is the spine here, sir. And the spine of the scapula will continue here laterally as a process, and this process will be referred to as acromion process. Acromion process, guys. So there will be the spine of the scapula that will continue as acromion process, and you can even appreciate one more thing here. The spine of the scapula is present posteriorly, then there will be acromion process, and that will actually come and join with the clavicle present here, and the joint between them, acromioclavicular joint. Fine. So posteriorly you will be having the spine of the scapula, laterally you will be having acromion process, and that is going to join with the clavicle here, and anteriorly you will be having actually clavicle there with the help of a joint there known as acromioclavicular joint. Now there is one muscle above the spine here, and there is one more muscle below the spine of the scapula. And that's the reason why the name is very much meaningful here. One is supraspinatus muscle, another one is infraspinatus muscle. So one which is above the spine will be supraspinatus muscle. Supraspinatus muscle, and the one which is below the spine will be infraspinatus muscle, guys. So above the spine you'll be having supraspinatus, and below the spine there will be infraspinatus muscle. Easy to identify. Now the last and final thing here, there will be a medial border of the scapula here, and then you have got the lateral border of the scapula here. Medial border and the lateral border of the scapula. Attached to the lateral border of the scapula, you're able to see like two muscles there, and those two will be the teres muscle. And attached to the medial border of the scapula also, you'll be able to find like two more muscles over here, guys, and those will be rhomboid muscle. So try to learn in the same way, same style. So first you learn supra and infraspinatus, and then about the lateral border and the medial border. On the lateral border, you can see the attachment of teres muscle, and above you'll be actually having teres minor. So this one will be the teres minor muscle, and below this will be the teres major muscle. So teres minor above, and below you'll be having teres major. And then on the medial border, there will be attachment of rhomboid. And again the same thing here, guys, there will be rhomboid minor, the upper one, and then you will be having one more, that is rhomboid major, the one which is below. So on the lateral border of the scapula, teres minor and major, and on the medial border of the scapula, you will be having the rhomboid minor and the rhomboid major, guys. And in this diagram, like one more muscle is not given here. Just imagine here, guys, there will be one more muscle, and that muscle will come and get attached here. Medial border only, just above the spine of the scapula here. It will also be attached onto the medial border only, but just above the spine of the scapula. And this muscle is known as the levator scapulae muscle. Levator scapulae muscle, guys. That's also an important one. Recently it was asked in the exam. Levator scapulae muscle. So that is about all the muscles which are actually present in this pectoral region here, guys, the shoulder region. And first I told you about the front view, and then we have turned back, and then back view, guys. So try to keep the entire thing in this manner in your mind. Now once you are familiar with all these muscles and their names perfectly, now the next target or the next challenge in front of us is to learn their nerve supply. What will be the nerve supplying to all these muscles? And again, guys, try to recall in the very beginning of this upper limb topic, I told you the concept of brachial plexus. So all those muscles has to be supplied by the branches which are coming from the brachial plexus. And try to recall my golden rule that I told you. Out of all the branches of brachial plexus that you are able to see on the screen here, all the branches are divided into major and minor. And major branches will be supplying to the muscles in arm, forearm and hand. But whereas the minor nerves will be supplying to the muscles surrounding the shoulder region here, guys. Is it okay? So it means that whatever muscles I have shown you just now, all those muscles should be definitely supplied by the minor nerves. है ना? And already in my diagram here, I told you, like beautiful planning, all those 5 muscles or 5 nerves that I wrote in capital letters are major nerves, and major nerves already we have completed in detail. Now what is the only thing left out, sir? Minor nerves. So we'll do one thing, step by step, one by one, we'll take up the minor nerves and we'll see it will be supplying to which muscles. Is it okay? And in that way, the entire brachial plexus, each and every nerve, you'll be like perfect. Anytime anyone asks you like any nerve supplying to which muscle, you'll be able to answer that one, guys. Is it okay? So let us now finish off with the minor nerves right now, step by step. So do one thing here, make a small table. On left hand side, let us write down the name of the nerve, the minor nerves, and then we'll write down like which muscle it will be supplying, sir. Muscle supplied by that. Fine. Now welcome back, guys. Let's go step by step. Now in this diagram, let's start with that LML again, sir. LML, L stands for lateral pectoral nerve. If there is a lateral, there should be medial also. First, let's deal with these two minor nerves, sir. So lateral pectoral nerve, and then there will be a medial pectoral nerve. Fine. First, let us deal with these two nerves now, lateral pectoral nerve and medial pectoral nerve. Now guys, from the name itself, we can understand here, pectoral nerve, and definitely this nerve has to be supplying to pectoralis muscle. And these two nerves, they'll be supplying to pectoralis major muscle, guys. Pectoralis major muscle. So pectoralis major muscle is a big muscle, huge muscle. It is supplied by both the nerves, lateral pectoral as well as medial pectoral nerve. So it makes that pectoralis major muscle also a composite muscle. Hope you are making a list of that one. That is also composite muscle supplied by two nerves. So if pectoralis major is supplied by both the nerves, then what about the minor? Pectoralis minor is supplied by what? Yes. Out of these two nerves, remember only the medial pectoral nerve. Only the medial pectoral nerve is the one which will be supplying to pectoralis minor muscle. So lateral pectoral and the medial pectoral, out of those two, remember only the medial pectoral nerve will be supplying to pectoralis minor muscles, guys. No confusion at all. Now let us again go back to the brachial plexus and let's see like what are the other minor nerves that we are left out with. So let me just strike off, guys, here. So are we done with the lateral pectoral nerve? Yes. Lateral pectoral nerve will be supplying to pectoralis major. Then already we have completed the musculocutaneous nerve in the major nerves category, guys. And we all know perfectly it will be supplying to all the muscles in the anterior compartment of the arm. Done. Median nerve also completed in the major nerves category. Median nerve will be supplying to the muscles of forearm, anterior compartment as well as muscles of hand. So in short, I am done with all the 3 LML branches, sir. So lateral cord, all the 3 branches are done perfectly. Now after completing that LML branches, again come down to the medial cord branches. Now in the medial cord, we have got M4U. In that M4U, M, medial pectoral nerve. Just now we have completed that one, guys. Medial pectoral nerve will be supplying to pectoralis major as well as the pectoralis minor also. Median nerve already done, the forearm and hand muscles. And then the medial cutaneous nerve of arm and forearm, we don't even have to worry about. The name itself is telling you they will be supplying to just the skin, medial cutaneous. The skin on the medial side of the arm and skin on the medial side of the forearm. So they are not going to supply to the muscles. And the very famous one, ulnar nerve, also completed in our major nerves category, guys. And ulnar nerve is also supplying to the muscles in the forearm and as well as the muscles of hand. It is a dominant nerve in the hand, sir. Wow. So it means I am also done with all the branches given by medial cord. Perfectly done. And now welcome to the last and final thing, posterior cord. Posterior cord, lunar branches. In that lunar, lower and upper subscapular. Yes, that is not done. So let's work out with that one, sir. So in this table mentioned there, one will be the upper subscapular nerve, and another one will be the lower subscapular nerve, sir. Now guys, again the same thing. I hope you already are getting an idea. The name itself is telling there subscapular nerve. And subscapular nerve has to supply to what? Subscapularis muscle. And are you all getting that picture back in your mind, guys? Subscapularis muscle, scapula, a flat bone, anterior surface, posterior surface. And on the anterior surface, there will be a big muscle, that is your subscapularis muscle, guys. So these two nerves are going to supply to subscapularis muscle. Subscapularis muscle there, guys. And again the same thing, there is one muscle supplied by two nerves, and that is also a composite muscle or hybrid muscle. Now in this I want you all to add like one more point here, lower subscapular nerve. Lower subscapular nerve will be additionally also supplied to a teres muscle. Now try to recall, will it supply to teres minor or major? I told you a number of times that teres minor will be supplied by axillary nerve. Axillary nerve will be supplying to two muscles, deltoid and teres minor. So definitely lower subscapular has to be supplying to teres major, guys. So lower subscapular nerve will also supply to teres major muscle. Now again, come back to this brachial plexus. We are not going to leave like any nerve here. So now we are done with the lower and upper subscapular nerve done, guys. After completing this, nerve to latissimus dorsi, thoracodorsal nerve, the name itself is telling it is going to supply to which muscle? Latissimus dorsi muscle. Done. Axillary already completed. It will be supplying to deltoid and teres minor. And radial nerve is the one which is taking care of all the posterior compartment. The posterior compartment of arm, triceps muscle, and the posterior compartment of forearm, extensor muscle, guys. So in this manner, we are also done with all the branches from the posterior cord, the lateral cord, the medial cord, and posterior cord. Is it okay? So don't try to, just simply mug up, guys. I'm telling you, try to make a logic. Even a subject like anatomy is also like very conceptual. There is some logic. If you apply proper logic, you don't have to mug up. So that old thing, like anatomy is like only about ratta, mug up, memorizing and all. No, apply the concept. So learn in my manner here, guys. Brachial plexus, the major nerves and the minor nerves. So all the major nerves are completed before, and now we are dealing with the minor nerves. Okay. Now, when I taught you about the branches, I told you that all the branches are given from cords, and not only from the cords, guys, we also get the branches from the trunk as well as the roots also. So we have done with the cords. Now let us focus on the trunk. How many trunks do you have? You'll be having like 3 trunks, upper trunk, middle trunk and the lower trunk. Out of these 3 trunks, only upper trunk will give you like 2 branches. One will be the suprascapular nerve, another one is nerve to subclavius. Now out of these 2, again the same thing, guys, no need to study about nerve to subclavius. Name itself is telling you that it is supplying to which muscle? Subclavius muscle. And I have shown you the picture of that just few minutes back. Clavicle, below the clavicle, subclavius. Chotu sa muscle, a small muscle there, guys. Subclavius, supplied by nerve to subclavius. Now, what about the suprascapular nerve now? Let's learn about the suprascapular nerve. So, that's also a minor nerve. So, let us just write down in this table. Suprascapular nerve. Suprascapular nerve, it will be supplying to 2 muscles, guys, which are present on the dorsal aspect of the scapula. Again, recall very quickly in your mind, scapula is a flat bone, anterior surface and the posterior surface. And on the posterior surface, there will be spine. Above the spine, supraspinatus, below the spine, infraspinatus. And both of them will be supplied by suprascapular nerve. Okay. So, suprascapular nerve will be supplying to the 2 muscles on the dorsal aspect. One above the spine, supraspinatus muscle, and one below the spine, that is infraspinatus muscle, guys. Infraspinatus muscle. So both of them will be supplied by suprascapular nerve. Now after that, again welcome back to the brachial plexus for the last and final time now. So we are now even done with the suprascapular nerve. So branches from trunk completed. Now the last and final thing is about the roots, and from the roots also you will be getting like 2 branches. One is dorsal scapular, that is only from C5, ventral rami of C5, and one is the long thoracic nerve, which will be from C5, C6 and C7. And I hope you already got the trick here right now, the entire logic here, how to handle all these branches and all now. So out of these 2 branches, long thoracic nerve, guys. Long thoracic nerve you don't even have to learn now. Why? Because it will be supplying to serratus anterior muscle. It is there in the name itself. Long thoracic nerve. It is also known as nerve to serratus anterior. So it will be supplying to which muscle? Serratus anterior muscle, boxer's muscle. Now the last and final thing that is left out is dorsal scapular nerve here. Dorsal scapular nerve. So let us just write down here. Dorsal scapular nerve. And now guys, try to correlate about the muscles. Are we done with pectoralis major? Yes. Pectoralis minor? Yes. And its nerve supply is done. Subclavius also done. And now after that we are turning back. Latissimus dorsi, serratus anterior, subscapularis, supraspinatus, infraspinatus, all these muscles are done. Even teres, minor and major also are done. Now, the only muscles which are actually left out here are towards the medial border of the scapula, that is rhomboids, and that has to be taken care by this nerve which is left out here. So, dorsal scapular nerve will be supplying to your rhomboid muscles here. So, one will be the rhomboid major, another one will be the rhomboid minor, and then yes, one more muscle which is present on the medial side, that is levator scapulae. Even the levator scapulae. Is it okay? So now that is a small table here finally of the minor nerves and the muscles it is supplying, guys. And now, my dear friends, all my dear doctors, just observe there the brachial plexus, not even a single nerve which is left there. Now I think all my students who are actually listening to me right now are expert in every nerve, each and every nerve, and it's supplied to muscle, guys. So in the brachial plexus, let anyone ask you any nerve supplying to any muscle, you can tell it very logically, very conceptually in this manner, guys. Is it okay? And before I have given you that golden rule, a small table of major nerve, okay, to the arm, forearm and hand, and now a small table of minor nerves, and that makes our life very easy in the upper limb topic. I don't know why unnecessarily the students will be like, cursing those first year MBBS days. We have mugged up all these muscles, individual nerve supply, no logic, nothing. Yes, welcome to my classes here, guys. That makes it easy here. The major nerves and the minor nerves here, guys. Done.